There's a great piece by our friend Walter Williams, who was actually on the inaugural program on Life, Liberty, and Levin. And it's on immigration. He writes, the Immigration and Nationality Act mandates that all immigrants and refugees undergo a medical screening examination to determine whether they have an inadmissible health condition. The Centers for Disease Control and Prevention has technical instructions for medical examination of prospective immigrants in their home countries before they are permitted to enter the United States. This has been done all the time. They are screened for communicable and infectious diseases such as tuberculosis, malaria, hepatitis, polio, measles, mumps, and HIV. They're also tested for syphilis, gonorrhea, and other sexually transmitted diseases. The CDC, don't tell the Democrats, they're going to say that that's not fair, that they shouldn't be tested. The CDC also has medical screening guidelines for refugees. These screenings are usually performed 30 to 90 days after refugees arrive in the United States. But what about people who enter our country illegally? The CDC specifically cites the possibility of the cross-border movement of HIV, measles, pertussis, rubella, rabies, hepatitis A, influenza, tuberculosis, and on and on and on. Chris Cabrera, a Border Patrol agent in South Texas, warned, what's coming over into the United States could harm everyone. We're starting to see scabies, chicken pox, I guess that's syphilis, and so forth. Some of the youngsters illegally entering our country are known to be carrying lice and suffering from various illnesses. Because there have been no medical examinations of undocumented immigrants, no medical examinations of undocumented immigrants. We have no idea how many are carrying infectious diseases that might endanger American children when these immigrants enter schools across our nation. According to the, does anyone care about this? Or is this just boring? Does anybody in the media? No, they don't. According to the CDC, in most industrialized countries, the number of cases of tuberculosis and the number of deaths caused by TB steadily declined during the 100 years prior to the mid-1980s. Since the 80s, immigrants have reversed this downward trend in countries that have had substantial levels of immigration from areas where the disease is prevalent. In 2002, the CDC said, quote, today the proportion of immigrants among persons reported as having TB exceeds 50% in several European countries, including Denmark, Israel. Israel's not a European country, but anyway. The Netherlands, Norway, Sweden, and Switzerland. A similar proportion has been predicted for the United States. The number of active TB cases among American-born citizens declined from an estimated 17,725 in 1986 to 3,201 in 2015. In other words, almost completely eradicated. That was an 80% drop. Data reported to the National Tuberculosis Surveillance System show that the TB incident among foreign-born people in the United States, 15.1 cases per 100,000, is approximately 13 times the incidence among U.S.-born people, 1.2 cases per 100,000. Those statistics refer to immigrants who are legally in the United States. There's no way for us to know the incidence of tuberculosis and other diseases carried by those who are in our country illegally and hence not subject to medical examination. This public health issue is ignored by all those Americans championing sanctuary cities. The public health issue is also ignored by Americans clamoring for open borders, and that includes many of my libertarian friends, writes Walter Williams. By the way, in the late 19th century and early 20th century, when masses of European immigrants were trying to enter our country, those with dangerous diseases were turned back from Ellis Islands. Americans had not, quote-unquote, progressed to the point of thinking that anyone in the world has a legal right to live in America. Neither did they think that it was cruel or racist to take measures to prevent our fellow Americans from catching diseases from foreigners. Put aside from diseases, there's the greater threat of welcoming to our shores people who have utter contempt for Western values and want to import anti-Western values to our country, such as genital mutilation, honor killings, and the oppression of women. Many libertarian types, and not just libertarian types, left-wing kooks, many libertarian types make the argument that we would benefit from open borders when it comes to both people and goods. That vision ignores the important fact that when we import, say, tomatoes from Mexico as opposed to people to the U.S., they are not going to demand that we supply them with welfare benefits. The bottom line is that we Americans have a right to decide who enters our country and under what conditions. And if we forego that right, we cease to be a sovereign nation. But that may not be important to some Americans. That is absolutely correct.